First of all, thank you all very much for joining us on this really important item. We have a panel of distinguished speakers and high-level officials from Yemen and the UK, and they'll be discussing the recent spread of COVID-19 pandemic in Yemen.
Yemen has reported only around 60 cases with some 1,000, a little over 1,000 fatalities. These numbers are not adequate at all. In last December, WHO conducted a seroprevalence survey by collecting blood samples of almost 2,000 people from Aden. It was discovered that 27% already have antibodies against COVID, meaning over 500 of the 2,000 had it. This means that almost 250,000 have been infected from the first wave, while we're only reporting 5,000.
As of all of us know, what their situation is suffering from war last 6 to 7 years, and also because of their low economic that make our health system is weak and poor in many aspects. With our all limited resources, so we start training of our health staff for how to be ready for the COVID. This second wave, it is rapid and quick spread as the cases come to duplicate, and so this make more pressure in our health system.
The situation in Yemen is reflecting the situation, the epidemiological situation, which is really occurring worldwide and in the region itself. So we have an accelerated epidemiology pattern. We need to see and the COVID not only as a health and prepared an emergency problem, but as well in the context of the disruptions that it imposes on the social aspect, the health aspect, and as well the economic aspect.
I'd like to speak about how we perceive Yemen from the UK. There is a Foreign and Commonwealth and Development Office situation report, and it highlights that many conflict-affected settings are experiencing a very sort of severe third wave, and it mentions specifically Syria and Yemen undergoing particular challenges.
So the first thing I'd like to address is a really basic question. Why should we be testing for COVID-19? The WHO has recommended that testing is a core component of the fight against the virus. And I think there are probably three major rationale for that. The first one is keeping track and understanding the exposure to the virus. And then off the back of that, obviously, of the point of view where when you're identifying these cases, it enables people to isolate.
This COVID-19 is different from the previous SARS-1 and Middle East respiratory syndrome in terms of high incidence and low case fatality rate. The main challenges in the global challenges form of the new variant and the vaccine. What means these global challenges for Yemen?
Here we can see the situation in Yemen, the first wave and the second wave, and the dormant phase between them makes the community more ignorant, make the health authorities more ignorant, and COVID-19 may become a seasonal disease in Yemen. We are afraid that this dormant phase could not be dormant with the emergence of new variant like Indian variant.
There are a lot of questions. Actually, I will start by the most popular and most common one asked by many attendees, which is about the 360,000 vaccine that was provided to Yemen last month, I think. And you provided 10,000 to the northern governorates. Would you please explain to us how, and there is a rumor actually saying that this 10,000 was rejected by the northern areas. Would you please explain to us about this status? Thank you very much.
We can accepting them to take vaccine, only they need to register and coordinate with us. But we are ready to deliver vaccine to all area of Yemen.
I want to finish it, with positive note. The positive note is that it was said that whatever we do, we will do it for Yemen, for the Yemeni people.